Weight stigma was a theme of a different day during Obesity Care Week.
Mm-hmm.
Talk about specific strategies to limit weight stigma while dealing with the needs of people like me with obesity.
Absolutely. I think one of the first things I think we can do is think about the language that we use when we're talking about the disease of obesity. When we say the word obese, that is a label. Obesity is a disease. So we need to eliminate the word obese from our vernacular, our vocabulary, because we're talking about patients that have obesity. We don't say a depressed patient, we say a patient with depression. A diabetic patient, we say a patient with diabetes. And so we need to be respectful in the very same way when we're thinking about how we use our language. When we're thinking about our interactions with patients that have obesity, we need to be thinking about, are we treating patients with the same care and respect that we would any other patient, without judgment and without bias? And that often takes doing a deep dive to figure out what your biases are.
Well, let me comment just as a person with obesity. I face weight bias, stigma, and discrimination every day. And there's this assumption that weight is my fault and that it's a personal failing. And I'd like to dispel that notion. And anything we can do to dispel that, I think will help with removing some of the bias and stigma that people like me face. I encourage you to think differently about obesity, that it's not as simple as eating less and exercising more. If it were that simple, we would not have 42% of our population with obesity. We just wouldn't. But it's not that simple. And I hope one of the things we've conveyed today to you is it is much more complex than that. And that you really take that on board and think about the way you're thinking about obesity and how you're treating people with obesity.